Placing a cannula, also called an intravenous or IV cannula, is a common medical procedure used to administer fluids, medications, or blood products directly into a patient's bloodstream. Below is a step-by-step guide to placing a cannula safely and effectively. Note that this should only be performed by a trained healthcare professional. Steps to placing a cannula. 1. Prepare. Gather equipment, sterile gloves, cannula, appropriate size for the patient and purpose, tourniquet, antiseptic solution, for example, chlorhexidine or alcohol wipe, IV tubing and fluid if needed, sterile gauze or cotton balls, adhesive dressing or tape, chaps container. Explain the procedure to the patient and obtain informed consent. Wash your hands thoroughly and put on sterile gloves. 2. Select a vein. Apply a tourniquet on the patient's upper arm or appropriate limb to make the veins more visible. Assess the vein for suitability, for example, dorsal hand, forearm, or antecubital fossa. Choose a vein that is large enough to accommodate the cannula, straight and not fragile, free from infection or inflammation. Step 3. Clean the site. Clean the chosen site with an antiseptic solution using a circular motion, starting from the center and moving outwards. Allow the antiseptic to dry completely. Step 4. Insert the cannula. Stabilize the vein by pulling the skin taut below the insertion site. Hold the cannula at 15 to 30 degrees angle with the bevel facing upward. Insert the needle into the vein in one smooth motion. You should see a flashback of blood in the chamber of the cannula. Once the flashback is observed, lower the angle of the cannula and advance it slightly further into the vein. Slide the plastic catheter over the needle and into the vein while withdrawing the needle slightly. Step 5. Secure the cannula. Release the tourniquet. Press down on the vein just above the tip of the cannula to prevent blood flow. Remove the needle completely and dispose of it in a sharp container. Connect IV tubing or a cap to the cannula tube, rather to the cannula hub. Secure the cannula in place with an adhesive dressing or tape. Step 6. Confirm placement. Check for proper placement by ensuring there is no swelling or pain at the site and that fluid can be administered without resistance. Flush the cannula with a saline to confirm patency. Step 7. Post-procedure care. Document the procedure including the size of the cannula, the site of insertion, and any complication. Monitor the site regularly for signs of infection, infiltration, or phlebitis. Tips for success: use a smaller cannula for fragile veins and larger one for rapid fluid administration. If the first attempt is unsuccessful, try a different site or ask for assistance. Always follow aseptic technique to reduce the risk of infection. This procedure requires practice and proper training. If you're not trained, seek guidance from a qualified healthcare professional. Thank you very much for watching. If you found this video helpful, please like and subscribe to this channel for more, and do also share to persons who might benefit from this video. Thank you.